So the form that you sign when you go into a doctor's office is called a HIPAA Notice of Privacy Practices, and that's not a consent form for treatment. It's not even a consent form about uses and disclosures of your information, and this is a common misconception. All it is an acknowledgement that you've received a notice of what's called a notice of privacy practices from your doctor or your hospital or even your health plan that provide the sort of outer boundaries of what a doctor or hospital can use your information to do, such as we will use your information to treat you, and we will use your information to seek payment, and you can obtain copies of your information this way. So it's basically just a notice to be transparent with you about what your rights and their responsibilities are with respect to your health information. It is not a consent form at all. Solving it by making it subject to patient consent sounds like an easy and empowering solution, but unfortunately in practice it would provide very weak privacy protection. It basically shifts the burden for protecting privacy entirely to the individual, who then is faced with understanding a consent form, reading it, understanding it, and knowing exactly what that means. And unfortunately consent forms are often written very broadly, and you're also asked to give it in contexts where you're not likely to be paying as much attention to your privacy rights or feel like you're empowered to say no. So we really think a comprehensive set of rules about how healthcare entities can use and disclose your information, of which consent plays a part but isn't really the linchpin, is the much more privacy protective way to go. Privacy rights for the dead is really actually not so much about protecting the privacy of people who have died, but it's actually about protecting the privacy of people who are living. Because in the context of health information, so much is determined based on genetics and family history that if you find out that that your grandfather had a certain inherited disease, the likelihood that you might also be a carrier of the gene for that disease or might get that disease is greatly enhanced. And so that information, even if it's about your dead grandfather or great-grandfather, is in fact information about you. And that's why our privacy laws, at least at the federal level, continue to protect information of dead people, because it is as much about privacy of the living as it is about the dead.